I'm here at Palmtree Clinical Research, joined by Dr. Zadeh. He's a gastroenterologist here, and we're going to talk a bit about colitis as well as Crohn's and your clinical research. How are you?
I'm good. Thank you for having me.
Yes, thank you. Thank you so much. So let's start with this. What is ulcerative colitis?
Well, ulcerative colitis is a disease of the colon. There are two types of inflammatory bowel diseases, Crohn's disease and ulcerative colitis, and they present differently in patients. Ulcerative colitis usually happens in a bimodal type distribution, usually between teenage years, early 20s, and then later on in life, 60s and 70s or so. It involves the colon, creates ulcerations, inflammation, causes diarrhea, cramping, bleeding. It's a chronic disease. It's really difficult to cure, but we could manage it.
Okay. I know you mentioned an age range there. Can you elaborate who is at risk for ulcerative colitis, or Crohn's for that matter?
Yes. Nobody really knows why people get these conditions. But what we know is with ulcerative colitis, usually teenagers present with it, with a lot of pain and bleeding and diarrhea. And then for whatever reason, there is nothing happening in your middle ages. And then if you're susceptible to it for whatever reason, it hits you again at later stages of life. The presentation is pretty much the same. The symptoms of bleeding and diarrhea and cramps and pain and weight loss is the same, and the only way to diagnose it is to do a colonoscopy and to biopsy the tissue and send it for pathology review.
Okay. All right. Let's talk a bit about this study that you're going to be, really, this is what you do here. This is clinical research.
Right.
Let's talk about the study and who you're looking for, who's perfect for this.
Sure. At Palmtree Research, we're excited to have different clinical trials, different clinical studies that comes our way. The mainstream of treatment has evolved throughout the years. For the past decade or two, we've started out with medications that were not 100% effective, probably 50% effective at best. That has changed for the past about 10, 15 years or so by introduction of medications called biologics that kind of alter your immune system to treat this disease. And there are better and better studies are coming out looking at different compounds, different agents, which have less side effects and also have better tolerability and help us better manage these patients. So currently we are involved in a clinical trial. There are some strict inclusive and exclusive criteria, inclusion and exclusion criteria, that once, if there's a patient who's interested and they contact us, during our sit-down interview, consultation, we would determine who would really fit into these studies and criteria. And I would really encourage people to take advantage of these studies. First of all, there's no cost to them. And these are, really groundbreaking, type, cutting-edge type medications that is currently not available to the general public. And these medications will be given to the patients at no cost to the patients, and we will monitor them per protocol. And it's really a nice step into scientific research and bettering medicine for everybody and the community.
Okay, all right. I appreciate your time. I really
You're
do.
welcome.
This
Thank
is important stuff as always. Yes. Palmtreeclinical.com is where you need to go to come check out Dr. Homan. He's a nice guy. He's very busy, so hurry. With that said, again, a big thanks to you, and the information's on the screen for you right there, website and phone number. We'll see you after the break.